The Ebola vaccination program has kicked off in rural areas in the Democratic Republic of Congo. The World Health Organization has shipped over 4,000 doses of vaccine to stop the spread of the virus. Congo's Health Minister, Ilunga, urged residents to come forward for the vaccinations to help stem the spread. Well, earlier we spoke to Dr. Mike Ryan. He's the Assistant Director General for Emergency Response at the World Health Organization on the progress of the campaign.
Vaccination against Ebola is proceeding very well. We commenced vaccination about a week ago in the Mbandaka area, which was the first priority. We've almost completed the ring vaccination there. We've vaccinated well over 300 cases, or 300 contacts and contacts of contacts. We are supposed to commence in the Koro area today, and we should be commencing in the area of Ebola by Wednesday. So by midweek, we should have commenced vaccination in all of the key areas in which the outbreak is occurring. We've been very, very pleased with the community response. I spent the day, actually I'm just down in Kinshasa, I'm back from Mbandaka last evening. I spent a day or two out with the vaccination teams, and I was really, really happy to see the level of positivity in the community. In fact, to be frank, I have done a number of Ebola outbreak responses, and it was the first time that I've seen hope in the face of Ebola and not terror. And the community was extremely engaged, very welcoming of the teams, and we haven't had refusals for the vaccine. So it does remain a challenge to find all of the contacts and find all of the contacts of those contacts. And we still have to work hard on the surveillance and finding all the cases. Well, I think the challenges are many. Certainly in many of the areas like Iboko and Itipo, they're very, very far from paved roads. They're very hard to access. There are issues with running water. There are issues in establishing treatment centres. There are long distances to cover. The roads are very poor. So it's very much a logistics nightmare, in fact, to run a health operation in those kinds of areas. That's one challenge. The opposite challenge maybe in places like Mbandaka, where you have a dense urban population, where one has to have a slightly different strategy. So while people are accessible to you, they move around a lot more, and they're harder to track and trace within a dense urban population. So there are many of those challenges that we face in terms of community engagement, ensuring the community understand why we're there, accept why we're there, and work with us and not against us. And I have to, in that regard, I take my hat off to Congolese doctors and nurses and social mobilizers. This is a Congolese response supported by the international community, and the vast majority of people working at the front line of this response are actually Congolese doctors and nurses and psychologists and anthropologists, and we are here just to provide the extra support they need to get this outbreak under control.